She started in the dentist chair and ended up in the emergency room.
An Osceola County woman says she was left broken and bruised after a wisdom tooth extraction. West 2 investigative reporter Justin Shecker shares her warning.
Monday, January 13th, 2025.
38-year-old Nancy Joseph recorded this video after a visit to a new dentist in Kissimmee went horribly wrong.
I was in an unbearable pain and my face was swollen so bad.
2 months later, she sat down with West 2 Investigates to share her story.
I'm still suffering from severe migraines, and I still have problems with my right eye and my face.
Her appointment was for a wisdom tooth extraction. While in the dentist chair, she says she had trouble breathing, so she asked the dentist to stop.
She eventually stopped, and then she resumed the attempt to extract the tooth. And after an extended period of time, I felt dizzy, and I told her that I couldn't see.
Joseph says she passed out in the chair, and when she regained consciousness, she was alone in the room.
I lost the ability to speak, so I had to tap on the metal object to gain one of their attention.
An ambulance brought her to a hospital emergency room.
I remember hearing the doctors declaring me to be in critical condition.
Joseph says her diagnosis was nerve damage, a mild jawline fracture, and an anesthesia overdose.
I have $50,000 worth of bills, medical expenses, and I still have not been able to have surgery because I now need to have oral surgery for the tooth that's still in there.
Joseph says she received oral anesthesia. Dr. Charles Buste explained that IV sedation is safer.
We get an immediate, within 10 or 15 seconds, we know where they are on the sedation scale.
Dr. Buste has more than 4 decades of experience as a dentist.
Fracturing a jaw is the same thing. That's just improper technique. That should never happen.
While he's been called upon as a dental malpractice expert witness, more than 2/3 of the time, he says, he finds no justification for the case to move forward.
I don't try to render an emotional judgment or any of that sort of thing. We just try to identify what went wrong, what were the proper protocols, and where were they breached.
His best advice for patients who feel discomfort during dental work:
do whatever is necessary to back out of the procedure and go somewhere else. Always go with your gut. If something feels wrong, it is.
Joseph says she feels fortunate she spoke up when she did.
Had it not been, God who prompted me to tell her to stop and call the ambulance immediately, I think I would have died in that chair.
For West 2 Investigates, I'm Justin Shecker.
Joseph says she's seeking further medical evaluation of what happened to her, and she's also considering her legal options.